Welcome to a series of videos that we're producing about upcoming regulatory changes that impact how drug manufacturers calculate and report prices to the government. Today's topic we'd like to talk about is an AMP rule topic on not generally dispensed and 5I drugs. When the regulators were considering how to write the rules for this, they realized that not all drugs go through the retail community pharmacy class of trade, which is where the law and where the intent is to monitor the retail community pharmacy class of trade as the benchmark for AMP. But they realized that some drugs don't go through that, particularly the 5I drugs. And so what they've done is they've created a two-part test to determine whether you use the retail community pharmacy class of trade set of transactions or you use a broader set of customers and more transactions to get a reliable AMP for those drugs that don't really go through the retail community pharmacy class of trade. This two-part test, the first part is it a 5I drug, which is essentially a euphemism for inhalable, injectable, the normal kinds of drugs that you did not expect to go through the retail community pharmacy but might be in a clinic or a hospital or something like that. The second part of the test, and that's only for the part that are the drugs that are 5I, is to determine if they're not generally dispensed through the retail community pharmacy class of trade. And the threshold the CMS put on that is 90%. So what the regulations require is that the manufacturer on a regular and periodic basis test to see whether their particular 5I drug is going through more than 90% non-retail community pharmacy, or if it's mostly going to the retail community pharmacy. This would then change and expand the number of transactions that are going to be included in there if it met that threshold level. So the issue then for manufacturers is really two-part. For each drug you need to determine if it's 5I or not. If it's a 5I drug, then you have the second part to ask, which is, if it's a 5I drug, is it generally dispensed or not generally dispensed? And for manufacturers that have drugs that are sort of on that 90% threshold, then they have the additional issue that their AMP values might vary period over period or quarter over quarter because of the variations between going 5I and non-5I and the generally dispensed.
And the CMS was also very vague when it came to determining and how often to determine whether your drug is 5I. It included language suggesting that the determination would have to happen on both a monthly and quarterly basis. This means you could have a drug that is generally dispensed in January, not generally dispensed in February, and then generally dispensed again in March, with little guidance regarding whether it should be generally dispensed or not generally dispensed for the full quarter. This has tremendous impact to your AMP calculation, and means you might have to have vastly different AMPs from quarter to quarter depending on this determination.
CMS has historically let manufacturers go to great lengths in order to be able to calculate AMP on a consistent basis, for example like smoothing. With products changing from generally to not generally dispensed, this would cause your AMP calculations to fluctuate on a more frequent basis. And this is going against what the policy set out to accomplish from the beginning. In addition, the financial impact of making accruals will make those almost impossible to manage.